name's Fenola Robinson. I had a hip replacement done on the 26th of March this year. Everything happened very quickly. From finally making the decision to go and do something about my hip, I saw a GP back in November. He referred me to the hospital. I got an appointment with a consultant by the December. We were going away on a family holiday over Christmas, so I said, please don't send for me for anything over that period. Anyway, by the time we came back, I had an appointment for January for the preoperative assessment. And at that time, they also said that I would be sent for to go to the joint clinic, which they said would be very useful, and actually it was an extremely useful thing to do. And the nurse actually went down and found out when my operation date was going to be. So I knew there and then, which was very good because I could make arrangements with work and things like that. So it just fell into place. The joint school was a very small, intimate affair. There was only about half a dozen of us. I was the only hip replacement person on that day. The others were knee replacement joints. But the overall information that they give you is general, and it's about things like they show you some very, very tasteful DVDs about what surgery will actually involve. So there's nothing gory or horrible to see, but they do explain how the joint will be replaced. They also explain what's going to happen to you on the day of admission, and they also explain about the kind of things that they want you to do ahead of surgery, such as the prevention of MRSA, that you'll be needing to use special shampoos and lotions and things like that, and also some special drinks that you need to take in order to supplement your diet. I know some people will have some issues about maybe using strange shampoos and putting ointments in their nose and things like that, and using creams on your skin. But when you consider that that's actually protecting you and protecting the unit, so it's very, very important that you do follow the instructions that they give you.
And how was the experience of the pre-load drinks? Did you understand that what they were?
I understood what they were used for. They do not taste very nice, but I did actually, for the same purpose, I could understand the reasoning behind them, so I did use them. And actually I had no ill effects from them whatsoever. Yes, when I went for the appointment for the preoperative assessment, it was a process. I was seen by 3 different people. First lady took all your observations and made sure that you were physically okay. Then the next person went through all of your past medical history, your drugs, medications, that kind of thing. And then I was seen by the occupational therapist, and he went through, what kind of equipment I might require. And they go into sort of what kind of house you live in, what kind of bathroom arrangements you have, which was very useful. So we actually came away with the fact that I would need a propping stool for the kitchen so that I could sort of rest against that whilst I was preparing vegetables or washing up. I had an over-the-toilet seat, which I thought was going to be not particularly useful, but it turned out it was absolutely invaluable. So that was the most important piece of equipment that I got. When I came in on the morning, I was advised to come in at 7:30, so my husband brought me. The night shift were just finishing their report, but a very nice lady showed me my room and just explained that if I wanted to just relax there, that somebody would be in to talk to me shortly. And sure enough, they were. I was seen by the ward sister. She introduced herself to me and explained what the unit was about. She asked me to just get changed into my dressing gown and operation gown and things, and she said that she would be back to take a full nursing history from me. Then another lady came and took blood samples, and then more or less as soon as she'd finished, the anaesthetist came through and he went through his checklist as well. So it had been so many years since I'd had any kind of operation. I thought it was going to be a complete general anaesthetic and that would be that. But he explained to me that it was actually going to be a spinal anaesthetic, but that I would not be aware of what was going on during surgery because they would have given me appropriate medication so that I would be asleep and not be aware of anything.
Recovery.
I was actually awake in the theatre.
Right.
Yeah, they put me on the bed, obviously, you're back on your bed,
Mm-hmm.
and then they wheel you through into the recovery area. There was quite a bit of work done with the anaesthetist, checking that the spinal anaesthesia was wearing off. So they use a sort of a fluid, like a cold fluid that they spray onto you. And at the beginning you can't feel anything, but that's quite normal. But then as you're waiting, they're spraying, and then by the time I returned to the ward, it was really just my feet that were still a little bit numb. I was given a cup of tea and a slice of toast, and absolutely fine. In fact, I didn't feel as though I'd had any medications at all. I felt lively and fully awake. I had the wedge, and I also had these inflatable boots, which they had explained what that was all about. And they're not uncomfortable. You could feel them inflating and deflating, but they're not uncomfortable in any way.
You just say you realise perhaps the blood clot, that's a risk of blood clots.
Yes, that had been explained to me at the preoperative assessment, and you were aware that that's why you had these booties on, and that you had to have an injection in your abdomen. And on my discharge, I was also given this medication to take for 30 days afterwards. I was very anxious to get out of bed, actually, and even on the day of surgery, I'd felt, because you have your own bathroom in your little room, I wanted to get out, but I did understand that it wasn't safe because you can't feel your feet properly. So you use bedpans, obviously, so that was fine. But by the next morning, I was up, out, over to the bathroom, and even had a short walk with the OT as well. So yeah, everything was fine. The staff on the ward were absolutely amazing. There wasn't an hour that you were on your own, really. There was somebody coming in and out all the time, checking, are you in pain? Is there any blood oozing from your wound? And they'd have a check on that. Constantly finding out if you needed any painkillers or anything like that. They would also explain that you might have some swelling as you start to mobilise. And to be quite honest, I wasn't affected by that whilst I was in hospital, but on my discharge, and I will say that the swelling is quite amazing. You know, if I hadn't been advised, I would have found it quite alarming. But as I knew about it, you know, the fact that it was like a tree trunk from the top of your thigh right down to your ankle, was very, very swollen. But then if you carry on mobilising, it does start to go down. The thigh goes down first, and the ankle is probably the last thing. On the day that I went home, it was explained to me that if I had any trouble, any problems whatsoever, even if it felt trivial, there was a telephone number direct to the unit, and that I could speak to a member of staff, and if they felt that it was anything that warranted it, that they would have me to come straight back to the unit and it would be handled there, rather than going to your GP and having to go the long ways round route.
Any worries about your wound at all or anything like that? Was that all managed fine?
The wound, I had internal suturing, but I also had external clips. I think there's about 30 of them. And it was explained to me that those would need to, my wound dressing would need to be changed. So they arranged to do that at the unit. So I came back a couple of days later, had that changed, and it was all checked over. They actually decided to leave it exposed because there was no oozing from it. And then a few days later, I went back and had the clips removed at the unit as well. And there's been no problem with it at all. Yeah. I think the whole process was a two-way street. I was made very aware of what the process was going to be, but also what I would need to do along the way. And all the time there was the opportunity to ask questions, there was information, there was leaflets, but there was also people there that were explaining things to you. It was all done. You felt very involved in the whole process.